Welcome to your custom deep dive. Today we're looking at an excerpt from the text titled Text. And our mission today is to really explore the often invisible social and psychological nuances of acrocyanosis.
Right, which is a condition that causes, visibly different, literally blue hands or feet.
Exactly. Okay, let's unpack this.
Yeah.
Because I want you to imagine stepping up for like a confident professional handshake. You extend your arm, you make friendly eye contact, but the other person just freezes. They pause and they stare right at your hands. How does that instantly shift the entire dynamic of that interaction for you?
Oh, it completely derails it. Suddenly, I mean, you're not a professional equal anymore. You're just this medical curiosity.
Right. It's almost like having a giant, unignorable stain on your shirt that you have to explain to literally every single person you meet every single day.
Yeah, that's a really great way to put it. What's fascinating here is how a purely physical symptom creates this immediate, heavy social barrier. It takes our most ingrained greetings, like that simple handshake, and turns them into a source of dread.
Because, people just blurt out, "Why are your hands blue?"
Exactly. Human beings are deeply hardwired to read physical cues. So when someone sees blue hands, their brain immediately signals an anomaly. But before we get into the social tax of all that, we should probably look at what's actually happening in the body.
Right, because it's not just that the hands are cold, they're visibly blue. Why does it present like that instead of, just turning pale?
Well, it comes down to localized vasospasms. Basically, the small blood vessels in the hands or feet abruptly constrict, usually triggered by cold or sciatica.
Okay, but if the vessels constrict, wouldn't the blood flow just stop completely?
You'd think so, but here is the key. It's not a total loss of blood flow. If it were, the skin would blanch and turn totally white.
Oh, I see.
Yeah. Instead, the arteries keep bringing oxygenated blood in, but the circulation is so sluggish that the blood gives up its oxygen to the tissues and then essentially just gets stuck in the capillary beds.
So it's sort of like a traffic jam in your capillaries. The arteries bring the cars in fine, but the exit ramps are squeezed shut.
That is a perfect visualization. The deoxygenated hemoglobin just parks there, which is why it takes on that blue tint. And that pooling is what causes the classic presentation of hands that are blue, cold to the touch, and surprisingly sweaty.
Wow. Blue, cold, and sweaty. Which brings us right back to the awkwardness of that handshake. Instead of a normal greeting, you are constantly forced to manage other people's reactions to your own body.
Right. And because those daily interactions are so incredibly stressful, patients are deeply driven to seek medical answers. It launches them into this whole emotional roller coaster.
I can imagine. You look down, your hands are blue, you probably assume your heart is failing or you have some severe vascular disease.
Oh, absolutely. The initial fear of the diagnosis is intense. It drives patients straight to a specialist, desperately looking for a cure.
But wait, let me stop you right there. If your hands are permanently blue and cold, how does a doctor just look at that and say, "Don't worry, it's mostly harmless"? What makes it benign?
Well, that's where we have to distinguish between primary and secondary acrocyanosis. Primary is what we're talking about here. It's a benign, persistent vasospastic disorder.
Meaning there's no actual damage happening.
Exactly. The blood vessels are hyperreactive, but there's no underlying tissue damage, no ulcers, no necrosis. So when a patient gets that diagnosis, there's this profound relief.
Like, phew, I'm not dying, my veins are just dramatic.
In a sense, yeah. But if we connect this to the bigger picture, that relief isn't absolute. It comes with a major caveat. The diagnosis isn't a cure, it's basically a sentence of hypervigilance.
Because they have to make sure it isn't secondary acrocyanosis.
Right.
So what does this all mean? You get the all clear that you are fine, but you still have to play detective with your own body just in case it's actually a warning sign of a deeper issue.
Precisely. You become hyper-aware of your own symptoms. You're constantly checking, is that shade of blue a little different today? Is the coldness spreading further up the wrist? It's an exhausting cognitive load.
That totally shifts the everyday patient experience. Once you know it's likely harmless but permanently visible, you kind of have to stop looking for a magical cure and just focus on practical management.
Yeah, it's a constant dual challenge. You're navigating public settings while trying to manage the physical discomfort alongside the aesthetic reality of brightly colored extremities.
I mean, think of the energy that takes. Wearing gloves indoors, hiding your hands under tables, or aggressively running them under warm water in the bathroom right before a meeting just to get a few minutes of normal color.
Right, and this raises an important question about how much energy patients expend just to appear normal to you and others.
Exactly. The physical symptom is right there on the surface, but the true burden is carried entirely underneath. It carries such a heavy, invisible psychological and social weight.
It really does. It's so much more than just a physical discoloration.
Which is why, as we wrap up, I want to leave you with this thought to ponder. Consider the quick, casual questions we ask people about their physical appearance. Do you get a sunburn? Or are you tired?
Yeah, we say those things without even thinking.
We do. But how often does our harmless curiosity force someone else to deliver an exhausting medical explanation they never ever wanted to give? The next time you step up for that confident professional handshake, remember, sometimes the most polite thing you can do is just ignore what's right in front of you.